This episode is brought to you by Intraprise Health, a health catalyst company. Make cybersecurity a priority, not a headache. Cyber attacks put patients at risk and cost healthcare organizations millions. But with convoluted software systems and risk and vulnerability data lost in silos, leaders know their organizations are vulnerable and they feel little control over the safety of their patients, reputations, or bottom line. Intraprise Health brings together cybersecurity experts with over 100 years of combined experience in healthcare to offer a comprehensive suite of innovative software and services. It helps leaders finally unlock a unified human-centric cybersecurity approach. With Intraprise Health, you can improve your cybersecurity posture, protect your patients, and simplify your employees' lives. Visit thisweekhealth.com/enterprise-health to find out more.
Hey everyone, I'm Drexta Ford, one of the principals at This Week Health and the 229 Project. Here, our mission is healthcare transformation powered by community. This is Newsday on the Unhacked channel, breaking down the cyber and risk stories that are impacting healthcare. Here's some stuff you might want to know about. Hey everyone, I'm Drex, and I have George Pappas with me again today. How you doing, George?
Good, great, Drex. How about yourself?
I'm great. One of my favorite guests. We always have a ton of stuff to talk about. How's everything going in general, though, before we get started?
Great. Looking forward to the fall. Had an interesting summer. We're cranking along, and the industry gives us plenty to talk about, doesn't it?
It does. And I curse you for calling the end of summer. That's not, no, I'm just kidding. I know I'm trying to stretch it out as long as I can too. There's a bunch of good stories that we kind of did a little prelim discussion on. One of them is about SBOM guidance from CISA. It comes out of Healthcare IT News.
Yeah.
And it's about their draft guidance for SBOM, minimum data elements, all those kinds of things. Start off, pretend none of us know anything about anything. Tell me about SBOMs, why they're important, and what this story kind of tries to drive home.
Yeah, I would basically say, the SBOM is like an ingredients list on the side of a package you buy in a grocery store, right?
Mm-hmm.
But it's supposed to be thorough enough and useful enough so that one can look in the ingredients and say, well, do I really want 5,000 milligrams of sodium? Well, maybe I don't. And, by the way, this other ingredient, is it aged past its due date? How safe is it? Right. And now I'll kind of cover it and relate to software. Does it use open source? What are the modules? What's going on there? So it's a useful notion that's actually been out there for some time. And this is the latest, I'll call it kind of tightening of the wrench on the actual specifications. I think what got my attention about this story was that, the government in many ways as the largest customer for all this stuff has been helping to slowly drive better practices, because as the government's been transitioning to cloud-based operation, you can just imagine the massive numbers of risks that they're trying to really guard against. And so this guidance, from what I understand, is going to be required for U.S. government use. Or, there's this notion, ATL, people a lot smarter than me understand all the nuances, but it's like authority to operate. A lot goes into that. But to me, what really resonated in healthcare was that we continue to have a massive third-party problem. And we have it for a lot of reasons. And, having done this now for a while and just presenting to a audit committee of $1.5 billion hospital last week, it is as much a software licensing challenge, because we have 40 years of liability and, damage liability practices and pricing models that have to adjust if more accountability is going to adjust, or we need safe harbor, something, Senator Warner talked about like almost 3 years ago now.
Right.
We need some measurement and management of the liability environment that we all operate in to really address the problem. And there've been some good proposals. But the other dynamic to this is that third-party risk is about more than just the ingredients in the package. It's what are the security management practices of the thing you're buying besides the ingredients? And the article talked about the lack of integration to the vulnerability database, right? And, even a basic best practice for a penetration test is to go check those public-facing things, look up vulnerabilities in the database. Are they not? Are they applied? Are they not? And so that integration needs to happen. The other thing that needs to happen is that What's their security posture?
Yeah, their own
are they
security
risk compliant,
program of
right?
the company that's making the
Exactly.
software or the hardware. Yeah.
Is it HIPAA? Is it SOC 2, NIST, or high trust, right? So that wasn't really talked about. And another thing that we've been doing a lot of work in at Intraprise in our products to help people consolidate and build security programs is building our systems using NIST OSCAL,
Hmm.
which is an open, controlled, and assessment language. So these are all coming from NIST in various shapes and fashions, but someone has to bring them all together.
Yeah.
So there's a more holistic picture of what's really going on besides the ingredient on the box,
Yeah.
ingredient list, you know?
I like that. I think that too, when you think about healthcare in general, we're not, generally speaking, we're not builders. So we're not
No.
bakers. We don't go out and get our own ingredients and make our own bread.
Right.
We're way more likely to go buy bread
Go to the bakery,
then-
right?
and then maybe put some jelly on it or something. That's the bread that we use. That's the
Right.
product that we use. And then we hit the pandemic and we really got out of the baking business. It seemed like more and more, not only do we get out of the baking
Right.
business, but we're not even keeping the bread in our bread box anymore, right? We went to the
Right.
cloud. And so more and more software as a service, more and more of those things were being built with ingredients that were opaque to us. We didn't
Correct.
know what was really happening inside of those applications. So to your point, this becomes sort of like the ingredient list. What are the things that you're doing inside that application? What tools are you using? What databases are you using? What protocols are you using? How are you doing a lot of things inside that, what kind of sometimes turns out to be a black box?
Yes.
Getting that set up so that we can actually sort of see it and understand it. But your point being, too, like that's just one dimension.
Correct.
Of this multi-dimensional issue.
Right. And this third party problem is really not going away. It was fascinating to me that just in the last few months, there was a law passed in Ohio, cybersecurity law, because the federal government's slowing down in some of this,
Right.
and a law in Maryland that would have required a more explicit third party clearinghouse that went through the legislature, but was vetoed by the governor at the last minute. So you're seeing at local level an awareness that there needs to be a little more precision, just like the HIPAA NPRM that has not been put in the law yet, had more explicit third-party requirements that have not been in the HIPAA security risk assessment, you know, for the last 10 years or so.
Right.
So there's a recognition of that, and that's coming, but it's not here yet. We have to operate today, you know, so that
it is almost like there's something coming eventually.
right.
But the reality is, I think you wind up sort of with people in sort of two camps. One is the compliance group of security people who kind of say, I'll do it when they tell me I have to do it.
Right.
And then there's I think the much more realistic group of people who are like, I don't really care that nobody's telling me that I have to do it. It's the right thing to do.
Yeah. Well, it's the right thing to do. And by the way, this is another very important angle here. The liability pyramid that systems are facing now when there's an event goes far beyond regulatory. It always has.
Yeah.
But you look at the last trailing 24 months, because we look at the data, the number of class action lawsuits, it's up like 10x.
Yeah.
Now, if you take change out, because that was obviously a massive event, so it's still up, 4.5 or 5x, right?
Yeah.
But when you look at what's in those class action lawsuits and the settlements, HIPAA what's the standard of care? You didn't do anything. There's a very different barometer now on risk, right? Yeah. And there was, and now how is cyber insurance related to this? There was a story. It was a municipality, not a healthcare system, that had a policy. They had an event, about an $18 million breach.
I know the story.
Yeah, they were not covered because they didn't implement the items that were in the conditions of the policy that they stated they had. So the noose is getting tighter, even while the regulatory part of it is still kind of rattling along.
Yeah. It's interesting too. To your point, I just read a story the other day. There are more personal injury lawyers now getting in on this data breach.
Yeah.
You know, so like the motorcycle lawyers and the car accident lawyers are now becoming data breach lawyers. And so they're all over it. And it's, you know, this is like, I don't know, I missed the commercial. Usually there's something on TV. Have you had data breached in your health system? Call 1-800-GEORGE now. And
hey, by the way, you heard it here first. there will be a John Grisham novel about this within the next few years. Because he's such a great writer about these things. He
Yeah.
has over time.
Yeah.
That'll tell you it's really arrived.
He's jumping on the very, very tippy top of the wave on this.
Yes.
I want to ask you about another story too. There's a whole mess of things that are happening with Salesforce customers around the world. And I know that you've been following that story close. Tell me what you think about what feels to be just lots of big companies who just are in trouble, not because of something they did, back to the third party kind of element of this, but because of something that is happening in their Salesforce instance. How'd this all happen? How'd it come together?
Yeah, well, these tokens, right? These to me, as I read about it and dug into it some more, we have already such ingrained integration mechanisms for cross-system involvement, and we store a credential here to be used over here.
Yeah.
But these cyber criminals are pretty clever. They can test the edge cases, right? And in this case, there was I think it was a customer service AI sales agent that used
I'm
an
looking it up
API.
right now.
Yeah.
I read this story, this other part of the story just the other day.
Yeah, used an API.
Sales Loft Drift AI.
Yeah, correct. Sales Loft, right? So, right, good thing people want to do, right? API access into Salesforce, because if you do a customer, you have to look up their thing, you have to tell them this, tell them that. Well, the cyber attackers clever enough to use the weakness in that or whatever really happened to get access into those accounts.
Yeah.
And guess what did they have there? Who did they breach first, by the way? All the cybersecurity companies. Notice that?
Yeah, exactly.
They stole AWS credentials.
Yes.
A lot of others. So they're going to the safe manufacturers to get the combinations that are stored for clients in their Salesforce system. Okay.
And they're reaching into Slack because the customer service bot on the website also has access to Slack. It's also got access to sort of Google Drive material in some cases. So thanks for all the APIs. They're really awesome. And they let me connect to lots, my tool to lots of other things. But in the spirit of, and I say this all the time, everything's connected to everything else. You find a tiny crack over here and it's really easy to make those hops.
Right. And, to me, what was also very interesting about this, of course, it's still relatively new. We'll probably hear more in a little while, but Salesforce has Health Cloud. A number of hospitals have been using it as their, CRM effectively. So Health Cloud is HIPAA compliant. Would they find a way to get in there once they got in? We don't know, right?
Yeah.
So there's some ramifications there, but the bigger picture, which Bill has been writing about a lot,
right,
is this notion of, that's kind of, so last generation integration. Now we're going to doing this AI agents through these, MCP layers that are more dynamic and flexible. We talked about this last time. I mean, how are we going to really measure that? And how are we going to really do our best to entrust as well as we can the veracity of these accesses and the safety of what an MCP layer is going to allow to happen inside of a system like that. And, I thought, to their credit, ONC, after a meaningful use, right, had a real slog getting Tefka up and running.
Yeah.
Because it was the best logical example of trusted exchange framework, technical protocol, security, common agreements. So when I have 1,500 BAAs, we have one to allow interoperability. Well, this is going to require a new level of that.
Do you think AI is going to be able to help with this? I hate to pile AI
I think
on
so.
top of AI, but yeah.
Used in very targeted fashions. I mean,
do you have an agent that's watching all these APIs, or an agent that's watching each API that maybe has some specific kind of discover
patterns? It's all pattern recognition. So that's why there's a lot of promise. I mean, in our product work, our AI integrations have had massive productivity improvements. We're just getting started. So I agree with you. There are patterns to be seen, patterns to be handled, identifier automatic shutdown to be happened, right? That's not in place yet. And this is running ahead. The other thing that struck me about it, last thing on this story, is clearly Epic at UGM had a very large announcement, which is really Epic as a platform
Yeah.
with agentic access through various swim lanes around different topics, right?
Yeah.
So how are they going to do this, right?
Yeah.
Now, I'm sure they can be as stringent as they choose to be in the best, most important way possible, which is certainly understandable and given their level of execution would be, expected. But, what will that bar look like? What will that mean for everybody else? I think is a pretty important question because MCP as a concept is very interesting, but executing it in some ways, I
Securely.
think it's a lot more complex than building the original system. Original systems were designed for finite states.
Yeah.
So there's a lot going on there that I think we're in the very early beginnings of.
It's man, I mean, there's so many places we can go with that. One more story I want to make sure we hit.
Yeah.
A lot of overlap with a lot of my friends in state and local government. They've been on a series of grant programs for the last several years that have helped them build better cybersecurity programs, buy more tools, do more things that they wouldn't normally be able to do given the resources that they don't have. And clearly, I mean, it's really easy to just kind of do a search on this, but every day there's a state or local government or department in a state government that is breached. Judicial, major cities, small towns, police departments, right on down the road. There's a series of industry groups that are asking Congress to expand state and local cyber grant funding because it's kind of a lot of this work is coming to the end. What's your take on this story?
Well, first, I hope they not only renew but expand it because in the article they talked about the group asking it to be more than tripled in size, which shows the extent of the need. And I kind of foiled that back to healthcare, rural healthcare. And, early 24, the then Biden administration had $1.5 billion just for healthcare. And I think it was about 700 million and 800 million. 7 was for everybody. 8 was for the rural hospitals. And you could take that definition up to 100 beds maybe and down.
I remember.
That, resources, margins, et cetera. And, that ended up not getting passed. But, we keep saying we have a problem. These are obviously public entities.
Critical infrastructure too.
Yeah, critical
right?
infrastructure
Does the 911
too, right?
system work?
Exactly,
can we flush
right.
the toilets tomorrow? And
Right.
is the hospital open?
Correct.
Is the emergency department running?
So, there's enough bipartisan belief, but given the climate and, in the Capitol, getting something like this really done, I think will be challenging, but at least I hope the basic renewal will be done and upsized. But it's a bigger window onto this infrastructure need that we have. And you've seen attempts to address it. Microsoft had this kind of in-kind program for a while.
Sure,
They did some good there,
yeah.
right? There are others, larger organizations that can do that, but
and there are some states that have stepped into that gap for their own hospitals,
Yeah,
New York and others,
right, with their law and their funding. So, but we're nowhere near a systemic problem, and every year we don't, the adversary gets smarter, more adaptable.
It is compound interest, right?
Yes,
I mean,
exactly.
the more that we don't do what we're supposed to be doing, the worse.
Yeah.
Linearly, the problem feels like it gets.
Yeah.
The more exposure that we have and the more risk, the more actual impact that could happen from an attack.
Yeah. I mean, there were, going back to the liability thing for a second, there were like 3 lawsuits around patient deaths from cyber attack.
Right.
Right. Because people are using paper. They don't have access to a certain MRI or other machine. They make a care decision, or there's a medical error. I mean, medical errors happen all the time anyway. They still do. Adverse drug events is kind of the nomenclature we use in the biz. But, these things are happening more when a team doesn't have access to certain tools that are offline because of a cyber attack. People, it's a complex service healthcare. They're in harm's way.
The other thing that I hear, and I've talked about this before all the time, when a system is offline, cyber attack or not, just when the EHR is down, I often get calls from friends who are clinicians, doctors, nurses, others who worry about their own, personal license because if they make a mistake, then they wind up under investigation and
Correct.
they may wind up losing their livelihood. And God forbid that anything happens to the patient they're taking care of. I mean, that's
Right.
even, a more tragic situation. All in an environment where those clinicians are already overstressed and there's not enough of them. And
Right.
there's too much work for them to do. Yeah, we live in a super complicated world, George. We got to keep making it better,
Yeah. One step at a time.
one step at a time. Thanks
Like
for
one
being on the
connection
show
at a
today.
time, right?
Thanks for being on the show today. I really appreciate it. It's always fun to talk to you.
My pleasure. Take care.
That's Newsday on Unhack with Drex DeFord. Get daily security insights delivered to your inbox because every healthcare leader needs a community to lean on and learn from. Sign up at thisweekhealth.com/subscribe and stay safe out there. I'll see you around campus.